My name is Nicole Parker. I'm a public health nurse here at the health department. Typically I worked in the clinic, but up until about 2 or 3 weeks ago when this first started taking off, our roles as nurses has really changed. A couple weeks ago, I think I also did some last week where I personally got to test some people for COVID-19. We basically did it outside, kind of like the drive-through surfaces that you're kind of seeing on the news. So we were able to do that at the driver's side. Basically, you have to protect yourself, so you get all dressed up in your PPE, your personal protective equipment. So you've got your gown, your mask, your goggles, your gloves, and then we go out there and then we swab them. Basically, it's that nasopharyngeal swab that kind of goes in the nose. I feel like I was happy to do it as far as you feel energized and you want to be able to do these things and help people that really need the testing. But it's also anxiety inducing because you yourself, you want to make sure that you're not going to get it yourself so you can still continue to do the work. You feel like you get to really use your skills to really help people. I feel like there's a lot of people here, a lot of people that want to be involved in this, but at the same time you also have this sort of anxiety about it. It's an exciting time to be in public health, but it's also a very stressful time. We're trying our hardest to kind of contain this, but as a healthcare provider, you don't want to bring this home. The anxiety is one thing that you can bring home to your family. You don't want to bring home this disease to your family. Just to have to roll in your car and get tested, not knowing what exactly, or we don't know the ins and outs, not knowing that of this disease and having to do this at the car side. They're appreciative that they can get tested, and that someone is willing to test them to figure out what this may or may not be. Fortunately, I think all of the patients that I've swabbed have all come back as negative. So in the long run, what we want to see is that this is controlled. That way, if people say oh, you're kind of overthinking things, you are going too far with this, that's better than having things blow up in our face. By adhering to these things, we can help prevent all this stuff, all the bad things from happening, or at least reducing that. That way, at the end of this all, we can just kind of come out of it. There will be less death, less dying of our loved ones and our friends and our families. We'll be healthy enough to go back to work. Our business owners will be healthy. They'll have healthy customers again. And I think that's one thing that you really need to keep in mind, is that we want to keep people healthy. So when this is all said and done and over, it'll be worth it because we'll be healthy individuals who can enjoy these things that we used to have.